When I found out I was pregnant, it was like you're waiting for this moment your full entire life, and it's finally here, right? And I just remember thinking, like, I'm gonna have a baby. I'm gonna be a mom. As excited, as I was as a new mom, like right away, I feel like I kind of knew something was a little bit different. When Harley started to not meet her developmental milestones, everything and in my educational background told me she's probably going to end up being on the spectrum, being diagnosed with autism. And that's a really hard thing to come to terms with, even if that is your educational background. To look at Harley and think that that's going to be her diagnosis. It was heartbreaking. We started getting physical therapy for her at-risk children. Harley's physical therapist said, hey, did you ever get her evaluated through the regional center? And I had no idea what the regional center was. And so she explained to me that they would come out to the home and they would do an evaluation and determine if Harley met the criteria for their early start program. And if she did, she would get services to help her meet her developmental milestones. I spent the first year and a half of Harley's life taking her to pretty much every specialist. She was getting all of her services through the regional center. She was getting occupational therapy. She was getting speech. She was doing ABA. And the changes that I saw in Harley were like, wow, huge, huge differences. I remember the first day that Harley started walking. The ABA instructor and I were standing in the kitchen, and Harley was holding on to her and let go of her and took 3 steps towards me. And I remember looking at her and saying, did you see that? Like, I didn't imagine that, right? Like, Harley just walked, right? And just from then on, it was like, you couldn't stop her. It was at Harley's 1-year annual meeting with the regional center, and I was expressing my gratitude to her IFSP worker, and I said, wow, like, the changes that we see in Harley are phenomenal. Like, my only regret is that I wish I would have gotten her in services sooner. How do more people not know about you guys? How do people find out about the regional center? And her response was word of mouth. After that conversation, I had a Zoom meeting with the people over at Department of Developmental Services. And I shared my story about Harley, our whole journey with her, and what I saw was missing. And it really was that education and outreach within the tribal communities that wasn't happening. CDC says that 4 out of every 10 Native American children have an intellectual or developmental disability. That's almost half of our kids. So last April 2021, I get a call from Leilani Walters with Department of Developmental Disabilities. And she said, Susan, I want to follow up on the conversation that we had a few months back. And she said, I just want to let you know that because of Harley, because of her story, she changed things. The department from here on out is dedicating $500,000 in their budget specifically for outreach for tribes. And I remember being like, whoa.
In the Native community, not a lot of people are going to admit that, their kids are on the spectrum or their kids have anything wrong with them, and this is where we have nowhere to turn other than other people or other parents that are in the same predicament that we're in.
But I can tell you that having Harley has truly been one of the biggest blessings. The things that she has taught me was really most important in life. And my focus was, I want a child to, and I want her to go to college. I want all of these things. And it's not that I don't want those things. But the most important thing to me now is to have a child that's healthy, to have a child that's happy. And when I look at Harley, I know that that little girl is happy and she is loved. And you can see it every time you look at her, just how loved she is.
I can admit now to people in my community that that my daughter is autistic or on the spectrum. Because my entire life I've been nothing but a problem solver. And Harley's something that I don't know how to fix. But I've come to the realization that she doesn't need to be fixed. We just need to adjust to her world.
She was sent here to teach us all something. When I look at Harley, her purpose really was to change hearts and to change minds and attitudes.
I want to be there for everybody, and I want to better our children. I want to better our community. I want to better the future of our tribe and tribes.
The thing that is going to bring about change is nothing that's up here. It has to come from here. And that is what started this. It was our love and our passion for our daughter and doing whatever we could to get her what she needs. And that is what we did. And it's her heart and who she is.
And this is Harley.
And this is Harley. She is the reason. She is the reason why we do what we do, and we're just gonna keep on doing it.
Thank you for your advocacy. I just want you to know that the Innovation and Advocacy Award is not just because she did so much advocacy for herself, but she took it to her entire tribal community of California. That's pretty awesome. Thank you.
Thank you so much. So I want to just reiterate what others have said before me, Tiffany and Nick. It really is very necessary for everybody to tell their story. And it was hard, speaking not just for myself, but for my husband as well. I've heard other people ask about, just some of the challenges that are faced sometimes with maybe having family members or other people from their cultural background that may not be as understanding or accepting of those disabilities. And that is one of the reasons why I think early on with Harley, we had a hard time going out in our tribal community, because we were so worried, at least I can speak for myself, I was so worried about how she would be treated. But what I really came to realize was there are so many other people going through the exact same thing that we're going through as a family. And, prior to starting Acorns to Oak Trees, I was the Director of Social Services for my husband's tribe, Paula, in Southern California. And I worked with so many families that arguably were very at risk and had children with these developmental disabilities. And my heart breaks now because I just think how many people have felt that isolation and just feeling like nobody understands their journey that they're going on. And so my husband and I, we wanted this to not be something that any other family really experienced. And we knew that within our tribal communities, as the video said, we have the highest rates of disability out of any other ethnicity in the nation. And we really are very under-resourced. And so we wanted to do everything within our power to bring those services directly to the tribal communities. And we can't do that alone. This work is not done by just one, but by many. My husband is the one that's driving that motorhome statewide. Be glad that I'm not doing it. I would take out many things along the way. He will tell you that. Also, the partnership with the regional centers, we could not do this work without them. I want to give a big shout out to Mr. Mark Klaus, Executive Director for San Diego Regional Center. Yes, he has been one of our biggest allies and supporters in launching the first clinic on the reservation. He helped fund this amazing, huge deck, accessible deck. We have these little construction trailers that we really gutted and kind of turned into really nice clinics on our reservation, on our ranch there. And really just the partnership and the dedication from the leadership from the different regional centers across the state and prior DDS leadership. We have not seen that too often in the tribal community, where we go to the state and say, hey, we're experiencing this challenge or what have you, and being met with that level of responsiveness and just heart. And I think that is one of my biggest things that I've come to realize. I was thinking in bed the other night, and I've always, been very voiceful of, I'm a member of a tribe, and I am a member of the tribe. And I always thought of that as just, one tribe. But the truth is that we've become a member of a much bigger tribe, and that's a tribe of disability advocates. And I'm very proud to be part of that family and growing village of support. And we look forward to helping to bridge the communities between the disability advocates and the tribal communities, because there still is so much more to be done. So thank you so much for being part of this journey with us.